today's session. Myself Rajita, and here we are going to discuss now today regarding a very common clinical manifestations we can say, which is often seen among the client who are seeking medical care and present in the hospital setup. Now, this particular clinical manifestations often will be associated with some underlying disease process, which will occur for a particular individual, even can cause certain effect on their body. So let us discuss today regarding a topic of nausea and vomiting. So here in this session, we are going to learn what do you mean by nausea and vomiting, what is the process or where a person would be having a vomiting, or what is the basic mechanism of the activation of the vomiting center, as well as what are the common causes or underlying causes that will be associated with the development of this clinical manifestation, as well as we are going to see the basic concept of the management of the vomiting. So let us start today with the topic. Now, nausea and vomiting. This is the most common manifestations of gastrointestinal system as we have known. Now, nausea and vomiting can occur independently, or even it can occur due to some underlying pathophysiological process or pathophysiological disease process. So often we see in most of the cases a person will be having certain underlying pathophysiological disease, which will be basically inducing the chances of the development of nausea or vomiting for a particular individual. But in few cases, we will be seeing the person will be only present with the nausea and vomiting, which will be completely an independent case. So now we should definitely learn what does nausea means. So basically, it is a feeling or a discomfort in basically in the epigastrium area of the particular individual with a conscious desire to vomit. Now, as we call this particular term nausea as the feeling of vomiting, so often we see that the person will be feeling or person will be having a feeling of discomfort just prior to the vomiting episodes. They will be telling they will be feeling some discomfort into the epigastric area or into the upper gastrointestinal system. Now, this discomfort or feeling of or sensory perception of discomfort, we are terming it as nausea. Whereas we are going to learn about the terminology of vomiting. So what does this vomiting means? So as we know, it is a forceful ejection of partially digested food or secretion of the upper gastrointestinal tract. Even sometimes we will be seeing from the lower gastrointestinal tract, the partially digested food will be coming out through the activity of vomiting. So basically, it happens when there is any disease processes present into the gastrointestinal tract. We are going to see that is the reason why there will be activation of the vomiting center and partially digested food. Sometimes even a complete digested food particles will be coming out through this particular episode. So as we have learned the basic meaning of these two terminologies, now you have to understand the vomiting or this forceful ejection of partially or completely digested food from upper and lower gastrointestinal tract basically is a complex activity that is going on. Now, this complex activity of vomiting requires coordination or coordinated activities of different structures. Now, here we are going to learn about the coordinated activities that generally occurs in an individual's body while the person is having nausea and the person is going for a development of episodes of vomiting. So the first thing happens when a person have the feeling of nausea. Next, we are going to see there will be complete closure of the glottis will occur for the particular individual. Next, we are going to see the person or the individual who are having nausea will be having deep inspiration with contraction of the diaphragm, even in the respiratory position. We are going to see the deep inspiration almost always will be associated with the episodes of vomiting. Next, we are going to see there will be complete closure of the pylorus. So as we know, in between the stomach and intestine, there will be presence of pylorus ring. Now, this pylorus ring will be definitely opened in order to progress the food particles from the stomach to the intestine for the further digestion and processing inside it. But here we are going to see in the third step of the complex activity of vomiting, there will be a complete closure of this particular pylorus ring. Now, it is going from the esophagus and progress to the stomach. We are going to see the lower esophageal sphincter will be getting opened. Once the food is passed, we are going to see the lower esophageal sphincter will be getting closed. But in case of vomiting episodes, we are going to see the stomach here will be relaxed due to the underlying etiological factor, as well as we are going to see the lower esophageal sphincter, which is located in between the esophageal tract as well as in the stomach, will be also relaxed. Now, as there will be contraction of the abdominal muscles, or somehow the abdominal or intra-abdominal pressure is increased due to certain etiological factor, it will be further relaxing the stomach as well as it will be relaxing the lower esophageal sphincter. And due to this process, we are going to see the contents from the gastric region or from the stomach, even contents from the intestine will be regurgitated and will be coming back from the esophagus towards the external portion of individual. Now, this episode, we are terming it as the vomiting. So this simultaneous activity where the force of the stomach contents is coming up through the esophagus, then it is coming to the pharynx and oral cavity and external part, we are terming this whole process as the process of vomit. Even the pylorus ring in between the stomach and intestine. Now, this is what actually is helping for the contents to come up through the esophagus into the pharynx, into the oral cavity. So now we should learn what are basically the etiological factor can be, which are almost always associated with the symptoms development of vomiting. So basically, here we're going to read about the etiological factor into two basic categorization. So first will be almost always associated with some gastrointestinal disorders. So as we know that vomiting is a complex procedures or complex activity which is occurring inside the gastrointestinal tract. It is basically a problem of gastrointestinal tract. So definitely the first etiological factors will be almost always associated with some underlying gastrointestinal disease condition. In the next part, we are going to see the disorders which will be unrelated to gastrointestinal tract but will be causing the presence or development of vomiting. So we are going to read the etiological factor in two different categories. The first one would be always the disorders related to the gastrointestinal tract. The second category we are going to run, these etiological factors are not related to the disorders or disease process of gastrointestinal system. So GI disorders or gastrointestinal disorders, which are very commonly associated with the development of symptoms of vomiting. So the common disorders involves the disorder of gastroenteritis. So as the name itself suggesting, it is the inflammation of the stomach or basically the wall of stomach. Even we can say here the whole part of intestine also will be involved. So basically there will be inflammatory changes into the wall of stomach and intestine. Now, gastroenteritis often will be causing the symptoms of vomiting, and it will be developed in a patient who are suffering from gastroenteritis. Next, we are going to see a disease condition of acid reflux, basically where we are going to see the lower esophageal sphincter is not having a proper closure. Due to that, what happens basically from the stomach, the acids will be getting reflexed and it will be coming up from the esophagus towards the pharynx and oral cavity. Now, this gas acid reflux disorders almost always will be associated with the development of symptoms like vomit. So gastritis also, involved in the development of the symptoms of vomiting. Constipation. If a person is having a prolonged constipation, we may feel the person, or we may see the person often will be complaining about the feeling of nausea and vomiting. Often, intestinal obstruction causes a forceful vomiting, or a forceful ejection. So, these are the basic disorders which almost always will be causing the presence of vomiting. Now, except this, many other conditions like gastro esophageal reflux disorders, or many disorders which is basically alternating the any activity of the gastrointestinal tract, can leads to the development of vomiting. So next we are going to discuss regarding the disorders which are not commonly related to the gastrointestinal tract but causing the development of vomiting for our client. So disorders which are not related to gastrointestinal tract includes pregnancy. So basically, pregnancy is a physiological condition, right? As we know. So here, vomiting is very common. Even nausea are very common among the pair's mother. So almost all of the women will be complaining about vomiting and nausea in the beginning, or in the initial phase of the pregnancy. Now, it is not considered as a pathological case because it is basically, this pregnancy induced vomiting is basically due to the hormonal changes that is occurring during the pregnancy period within a woman's body. Now, if it is manageable, or if it is subsiding on its own self, the pregnancy induced vomiting is very normal or common, which will be basically managed with very minimal drug and certain lifestyle modification and dietary intake. So, but if the client is having any pathological condition, the person here, while in pregnancy state, can develop hyperemesis gravidarum. So this is considered as a pathological condition where the person will be showing a profound symptoms of vomiting which will be uncontrollable, and often this condition of hyperemesis gravidarum will be having very less responsiveness towards the prescribed treatment. So that is the reason why in pregnancy it is very common to see vomiting will be present for the client. The next condition which is often associated with the presence of the development of vomiting for a client is infection. Now, a systematic infection, or an infection which is occurring basically to the other portions of the body except the gastrointestinal tract, also often can cause the symptoms of nausea and vomiting for the client. Next, we are going to see the disorders which are basically related to the central nervous system. So, for example, brain tumor or tumor into any portion of the central nervous system, as well as meningitis, often will be causing the presence of the symptoms of vomiting for the client. Now, meningitis and central nervous system associated tumor is tend to, active the vomiting center, which is basically located into the brain for a particular individual. Due to the activation of the vomiting center, we are going to see here the client will be almost always having a very frequent development of vomiting episodes if they're diagnosed with conditions like meningitis and brain tumor. Next, we are going to see certain cardiovascular disease as well can develop the symptoms of vomiting. Now, this disorders includes the myocardial infarction, even heart failure. So myocardial infarction basically will be, what happens here is the blood circulation into the myocardium layer of the heart will be disrupted here. So as we know, this will be definitely disrupting the functional ability or functional contraction and relaxation of the heart. Due to that, the blood circulation here will be definitely disrupted. Next, we are going to see the disruption of the blood circulation almost always will be diminishing the blood circulation towards the gastrointestinal tract. Now, as we know, the gastrointestinal tract require a continuous blood supply to continue the digestion process. As in a myocardial infarction or maybe heart failure, where there is a complete absence of the heart activity or decrease in the functional ability of the heart, we are going to see the disruption in the blood circulation to the gastrointestinal tract will be definitely causing a disrupted digestion process. Due to that, often we are going to see a client who is suffering from any heart or cardiovascular or circulatory disease will be developed with vomiting. Often this vomiting will be induced because there is partial digestion is taking place into the stomach, or the blood circulation as it is disrupted, the sphincter will be losing its functional ability. Even the stomach will be getting relaxed. So that is the reason why we are going to see the person will be developed with vomiting. Next, we are going to see the metabolic disorders like diabetes mellitus, Addison's disease, if severe enough, sometimes can actually cause the development of vomiting for a client. Post-operative phase. So if the client is in a post-operative phase, basically if they have administered with certain local anesthesia, we are going to see as a side effect of those local anesthesia, a person in post-operative phase almost always have a high risk for the development of the condition of vomiting. Now, the usage of certain drugs, basically the drugs like which we definitely use in chemotherapy, the drugs which are often known as opioids, which are basically the analgesics, as well as digitalis. This three classification of drug, if used for a particular client for a chronic time or for a long duration, as a side effect, a person may suffer or may develop the symptoms of vomiting. Now, rather than this, many other drugs also have their side effect of vomiting. So, if a person is having a medical history where they are using medications for a prolonged time, they can actually develop the vomiting as a side effect of the medicine. Psychological factors. Now, psychological factors are very commonly associated with the development of nausea and vomiting. Most of the people will be complaining about the sensation of nausea if they're highly anxious or if they're having or suffering from a prolonged stress. Even sometimes a certain environmental scenario, if it is very stressful, can induce the nausea and vomiting for individual client. Now, other many factors are there depending on their body physiological need, the height, the tolerance level of the stress. The dietary intake often will be associated with the inducing vomiting. Now, a condition which is very oftenly, associated with the development of vomiting episodes is migraine. So often a client with a history of migraine will be complaining about several episodes of vomiting associated with the migraine attack. So I hope these are the basic disease which often will be related to the development or with the development of the symptoms of vomiting for a client. Now, other than these diseases, many other factors can be present for the person if they're having or developing with the episodes of vomiting. It can be the dietary intake. So sometimes the person, if they're having certain foods and that is not digestible or that is heavy for them, or they're eating beyond their appetite, we're going to see the client can have episodes of vomiting related to the uncoordinated digestion or decreased digestion. Even certain food particles can cause the induction of vomiting for a client. Now, if a client had certain foods which are uncooked or unhygienic, often can lead to the development of vomiting episodes for the client. For some individual, if they are traveling to a height we are going to see the person will be having the sensation of nausea and vomiting. So these are the other factors which are often related to the development of episodes of vomiting. So I hope till here you are completely have the idea regarding the most common etiological factor which is associated with the development of this symptom. So as I have noted that vomiting will be basically controlled from a center that is located in the central nervous system. So vomiting centers basically is present into the brain stem. So this brain stem or this vomiting center which is located into the brain stem will be coordinating multiple components in this activity or in this complex activity. Now, we are going to learn that the centers will be receiving the input from various stimuli. Then only as the action of the stimuli is activating this vomiting center, we are going to see the person will be developing the sensation of nausea, even there will be development of the episodes of vomiting. So we are going to see here the neural impulses will be reaching to the vomiting center via the afferent pathway through branches of autonomic nervous system. We are going to see here the afferent nerve branch of autonomic nervous system. We will be transmitting the stimuli or impulses to the brainstem into the vomiting center where the activation of it will take place. The receptors of this afferent nervous pathway of autonomic nervous system will be generally located into the gastrointestinal tract. Even it will be located into the vital organs like kidney, heart, even uterus. So we are going to see these receptors will be first getting activated or will be producing certain electrical impulses and action potential. Through these receptors, these action potentials will be traveling to the vomiting center via the afferent nerve pathway of autonomic nervous system. Now, as the afferent nervous pathways is communicating the action potential to the vomiting center, we are going to see there will be activation of the vomiting reflexes. And that is the reason a person will be developed with episodes of vomiting. Now, the chemoreceptor trigger zone, which are definitely located into the brain stem, will be often response to the chemical stimuli. Basically, chemical stimuli like drugs, toxins, even labyrinthine stimulation. So this all chemical stimulation will be affecting this chemoreceptor trigger zone in the brainstem. So once these are stimulated due to the toxins and chemical stimuli, we are going to see this chemoreceptor trigger zone will be transmitting the impulses into the vomiting center again, where the vomiting reflexes will be induced for a particular individual. Now, as this vomiting reflexes or the activity of the whole process of vomiting is basically controlled by autonomic nervous system, which will be often resulting in both parasympathetic and sympathetic nerve branch stimulation associated with the vomiting center reflexes production. We are going to see due to the activation of the parasympathetic and sympathetic branches here, the client will be almost always present with certain associated manifestations along with vomiting. Now, this common manifestations which are basically often found on a patient who are having vomiting episodes includes tachycardia, that is increased heart rate. Even the client will be present often with tachypnea, that is increased respiratory rate. The person will be showing the feature of diaphoresis, that is excessive sweating. Now, these are all very common manifestations that is occurring due to the activation of the sympathetic nerve branch of autonomic nervous system, which will be often associated with the presence of vomiting. Next, we are going to see certain common manifestations which will be associated with episodes of vomiting and is caused by parasympathetic nerve branch activation. So here in this parasympathetic nerve branch activated symptoms, we are going to see the client can present with the increased gastric motility. Even the client will be almost always showing the characteristics of increased salivation. Even there will be a complete relaxation of lower esophageal sphincter. Due to that, a person will be having simultaneous episodes of vomiting. Now, other clinical manifestations which are basically caused because of these vomiting episodes include nausea. So, as I said, often with vomiting episodes, our client will be subjective regarding the sensation of vomiting, which we term it as nausea. The other clinical manifestations which are very common with vomiting episodes is anorexia, that is loss of appetite. So once the client is having the vomiting episodes or the feeling of nausea, the person also will complain regarding the presence of anorexia or loss of appetite. So the effect of the vomiting also will be very compact for the person. So often a person with severe episodes of vomiting will be developed with the condition of dehydration. Basically, the dehydration will occur due to the fluid loss through vomiting. Even the client in a severe case will start develop with fluid electrolyte imbalance. We are going to see the extracellular fluid for the client who are having severe vomiting will be definitely having less or decreased amount of extracellular fluid, which will be often associated with the development of dehydration. We are going to see a client even will be having decreased plasma volume if the vomiting is severe enough and not treated or uncontrollable. In severe term, the client can develop the condition like metabolic acidosis. Circulatory failure also can present as there is a depletion of the fluid volume inside the body. Metabolic acidosis will be basically occurring as there is a loss of intestinal content. Even sometimes a person may develop with metabolic alkalosis too associated with the episodes of vomiting. Weight loss is common for client if they're having severe and chronic vomiting episodes which is not managed or not treated. Patient who are having the or basically who are unconscious and having a prolonged episodes of vomiting can have even pulmonary respiration, so which is basically considered to be one of the most fatal complication associated with vomiting. So as here we have learned regarding the etiological factor, the pathophysiology where we have learned the stimuli which are basically present over the gastrointestinal tract, the major organs like the heart, kidneys will be accepting the noxious stimuli. Now this will be transmitting the action potentials or converting the action potentials and help the efferent nerve branch of autonomic nervous system to transmit the stimuli to the brain stem where the vomiting center is present. Then the vomiting center will be getting activated where the person will be start initiated with the vomiting reflexes and they will be developing with vomiting episodes. We have also seen the probable clinical manifestations which are often associatedly present with the episodes of vomiting, as the autonomic nervous system here is activating the parasympathetic and sympathetic branch too. We have also seen the basic manifestations which are the impact of vomiting into a client's body. Now we are going to read about the collaborative care. So often you need to understand the concept that vomiting, if it is treated or managed at an initial period and at earliest, the client may not go for further development of any complicated disease condition development. So that is the reason the collaborative care should be very prompt and it should be initiated at earliest as possible. Often the vomiting also will be associated with some underlying pathological condition. So treating that particular condition definitely will be helping to remove the condition or remove the development of the episodes of vomiting. So here we're going to read about the basic procedure of management to manage the client with vomiting. So first, we are going to see the client will be going for, or the medical professionals will be performing a history collection. So history collection here includes a past and present medical history, surgical history, their family history, as well as their lifestyle. Even they need to ask if it is like if the client is woman, chances for the pregnancy state also should be considered here. So assessment would be basically done to find out whether there is any presence of known medical conditions which is inducing the vomiting, or whether the person is having episodes of anesthesia administration, or if the person is having a history of usage of certain medications which side effects are causing this. So assessing the history collected or collective data from the history collection would definitely help the medical professional to identify the probable cause. Now next, physical examination should be ensured or performed by a medical professionals for the client. Here definitely a head-to-toe assessment would be done. Even the systemic assessment would be done to find out the probable cause associated with the development of the episodes of vomiting. We're going to see the integumentary system should be assessed for the presence of pallor. Even the mucous membrane should be assessed for the presence of pallor. Skin turgor should be assessed here to identify whether the person has developed the problem of dehydration associated with vomiting episodes. The person also should be asked, or basically the caregiver would be asked to identify or to note the amount of vomitus, the frequency of the vomiting episodes, the content of it, the color of it. Now, this basically gives a very basic idea that due to which reason the vomiting episodes has been developed for the client. Intake output also should be charted by a medical professionals if a client is admitted with episodes of vomiting in a clinical setup. Now, the differentiation between vomiting, regurgitation and projectile vomiting should be done, because the management and the treatment would be definitely differ from this 3 episodes. So in regurgitation, we are going to see the person will be having a effortless process in which generally the partially digested food will be slowly coming up from the stomach. So here the person won't be having the urge to vomit or to exit the food contents from the stomach. So that is the basic difference between the regurgitation and vomiting. So the differentiation should be done from the regurgitation and vomiting. Next, we're going to see some person will be complaining about projectile vomiting. So we are going to see it will be a forceful expulsion of the stomach contents without nausea, and the characteristics of basically the projectile vomiting will be often related with some disorders related to the central nervous system. Basically, in central nervous tumor associated disease can lead to the development of projectile vomiting. Even in case of intestinal obstruction, sometimes we may see the person will be present with projectile vomiting. So that is how medical professionals should differentiate between normal vomiting episodes, a regurgitation, even a projectile vomiting episodes, to find out the exact probable causes as well as to plan a proper treatment and management. So assessment would be done here for the client. So for example, the assessment of the emesis, if it is containing partially digested food several hours after the food intake, will be definitely indicated that there is some disorders related to the gastric outlet, or obstruction or delaying of the gastric emptying, or some disorders will be present related to the digestion process inside the stomach. So that is how we are going to assess the emesis, and will be considering the probable causes that can develop the episodes of vomiting. So for example, the presence of fecal odor, even the presence of bile in a prolonged vomiting state will be suggesting that there is presence of intestinal obstructions below the pylorus level. So that is how we are going to assess the emesis and the pattern of vomiting and the content of vomitus, and we are going to suggest the probable causative agent related to the development of the episodes of vomiting. Even bile in the vomitus often will be suggesting that there will be some obstructions which is generally present below the ampulla bladder. The color of the vomiting should be, or vomitus should be assessed because it aids to identify the presence source of vomitus. So we are going to see if the client is present with bleeding in the vomiting. It will also aids the information of the source of the bleeding. So generally, a vomitus with a coffee ground color often suggested a gastric bleeding, where the blood will be changing into dark brown color as a result of the interaction with the hydrochloric acid inside it. So that is the reason brown or coffee ground color often will be suggesting that the bleeding is from stomach. So bright red color in the vomitus often will be indicating that the bleeding is basically from the esophageal varices or the upper respiratory or the upper gastrointestinal tract, or maybe due to a gastric or a duodenal ulcer or neoplasm. So this is the basic factors which are often will be causing the presence of fresh bleeding into the vomitus. So next we're going to learn about that if the client is present with early morning vomiting, it will be almost always suggesting that the woman client is having a pregnant state. So that has to be noted. The time of vomiting also helps to identify the probable causes of it. Now, if the client is having vomiting episodes related to certain emotional stressors, we are going to see that there will be no evidence of any other pathological conditions, and the symptoms or the episodes of vomiting may elicit during, even immediately after eating. So as we have learned here related to the probable clinical manifestations and the pattern of vomitus which should be assessed, we have learned here. Next, we are going to see certain diagnostic tests and procedures which will be often performed if a client is having severe and chronically presence of a severe vomiting state. We're going to see first often the complete blood count will be done and fluid electrolyte status measurement should be done for the client. So assessment for the dehydration and serum electrolyte balance should be checked here for the client with a prolonged vomiting episodes. The client will be often having a chance of the development of metabolic alkalosis and acidosis. That is the reason the assessment of ABG or arterial blood gas analysis often will be done to find out whether the person is having any chances of the development of alkalosis or acidosis. If it is directly related to certain conditions related to the gastrointestinal tract which is not identifiable, endoscopical procedure or maybe abdominal x-ray would be done to confirm the conditions. Now, depending on the probable causes or other symptoms which are present associated with the vomiting, which is indicating that there is presence of certain other disease rather than GI tract, depending on the patient condition, different diagnostic procedures will be performed to find out the exact underlying pathological condition which is considered to cause the development of episodes of vomiting. So as we have studied the diagnostic procedures, definitely the history collection, physical examination and the diagnostic procedures will help a medical professional to conclude the diagnosis of vomiting. Next, the therapies definitely includes usage of many pharmaceutical agents. Now, the most commonly used pharmaceutical agent are phenothiazines. Phenothiazines, the examples of is promethazine, often will be used to manage the vomiting episodes. Next, we are going to see the usage of the group of drugs which are known as antihistamine. Here, we are going to see the hydroxyzine often will be used here to manage the symptoms of vomiting. Prokinetic agents like metoclopramide often will be used for the client to manage the symptoms of vomiting. Serotonin antagonist often will be used here. Other drugs which are commonly used to treat the episodes of vomiting includes anticholinergic. Butyrophenol often will be used here to manage the symptoms. Droneminol is very commonly used drug group to manage the symptoms of vomiting. Even we are going to see all these drugs will be commonly used to manage the client. Now, depending on the client's condition or the underlying disease condition, we will be assessing the need of the drug, and a physician would be definitely prescribing the needed drug or needed pharmaceutical agent to the client to manage the symptom. Now here, to manage the client with vomiting, nutritional therapies plays a very important role. Often, IV fluids or intravenous fluid therapy would be provided to the client to maintain their electrolyte as well as their glucose replacement process. So here, often a client will be having the chances of the development of hypoglycemia and imbalanced electrolyte. So initially, as the person is having frequent vomiting episodes, if oral fluid is not tolerated, the person is not managed with the episodes of vomiting, a intravenous fluid administration plays here a very important role. Sometimes even we can able to see the usage of nasogastric tube and suction, because it will be helping even to decompress the stomach if there is a excessive amount of content present in the stomach, which is ultimately causing the episodes of vomiting. So nasogastric tube insertion and suctioning also plays a very important role to manage the client with vomiting. Now, once the treatment procedure has been achieved and the person is relieved from the episodes of vomiting, we are going to see once the client is tolerated or well tolerated with oral intake, we are going to start the feeding with a very clear liquid. Even carbonated beverage will be used, which will be at room temperature, and generally it will be used only when the carbonation is gone. Now, often warm tea often will be advised to the client to have it. So these are the basic fluids which will be initially administered or given to the client once they're managed with a vomiting episode. Dry toast and crackers almost always is suggested for the client to have soon after recovering from the vomiting episodes. Generally, it is suggested to intake of small amount of fluids, that is 5 to 15 ml with 15 to 20 minutes. So usually this will be better tolerated rather than giving a huge amount of fluids altogether. So often a client, as the liquid fluid is well tolerated, we are going to provide the high carbohydrate diet. Mostly the low fat diet is suggested in this stage. Items like baked potato, plain gelatin, cereals, and hard candy almost always will be offered to the client once they're managed with the vomiting episodes. Coffee, spicy food, high specific or high food which are basically high in fat saturation should be avoided by the client. It is generally suggested. Even the client will be suggested to avoid those foods which are having very strong odor. Often, the client will be asked to have a very small amount of food but at a frequent interval to reduce the chances of the overdistension. So, non-drug therapy often includes the usage of acupressure and acupuncture for a client who are having the vomiting episodes related to the underlying chronic disease process. For example, if a client is receiving chemotherapy, as a side effect, they will be often having a chronic episodes of vomiting. Acupressure plays a very important role here to manage the client or manage the discomfort related to the episodes of vomiting. Even we are going to see the usage of herbs like ginger, peppermint oil often will be helping to induce or increase the comfort level of the client who are having a chronic episodes of vomiting. Relaxation, breathing technique or exercise often helps the client to improve their conditions. Changes in the body positions according to their comfort level often helps to avoid the episodes of vomiting. Adequate rest and sleep, a proper dietary intake, and a regular exercise should be suggested if a client is having a prolonged development of episodes of vomiting. Now, as we have learned about basic drug and non-drug therapies, now we are going to learn about the nursing role. So, nursing role and responsibility in managing the client with vomiting here plays a very important role. First, definitely nursing assessment should be done, which definitely includes a detailed history collection and physical examination, where they will be finding out the need of the patient. Depending on that, a nursing plan should be implemented. So definitely the assessment should be done for the presence of nausea, the deficient fluid volume, improper nutritional level for the client, and even the activity level of the client should be assessed here. The skin tiger should be measured while doing a physical examination to find out the level of dehydration. So the goal of the nursing management with the client with vomiting often includes the reduction of the nausea and vomiting, maintenance of the electrolyte level, as well as reduce or maintain a normal intake and hydration level for the client. So as we know, the persistent episodes of vomiting need hospitalization. So definitely a client should be monitored. A continuous monitoring of the vital signs and hemodynamic stability should be done within the hospital setup. Nurses have the major responsible role here. The client here definitely should be on nil per oral status, and they should be managed with intravenous fluid administration. So here a nurse plays a very important role to calculate the amount of IV fluid that should be administered to the client to maintain their hydration level. NG tube or nasogastric tube placement and suctioning should be done by a nurse if it is required for the client. Explanation should be provided regarding the importance of the diagnostic tests and the planned medical treatment for the client. Monitoring of intake output chart for the client with persistent vomiting episodes, positioning of the client to reduce the aspiration often helps the client to have a proper promotion of health. Sign of the dehydration also should be assessed by a nurse at a regular interval, as the dehydration is the most common complication associated with the episodes of vomiting. Physical and emotional support should be definitely provided to the client. Even the caregiver should be explained regarding the planned procedures and the need of the diagnostic tests. So basically, the vomiting, as I mentioned, if the disease condition or underlying disease condition is managed, often will be able to managed by a client. So here, nurses plays a very important role even to maintain the rehydration of the client. Home care teaching should be done by a nurse here. So definitely a nurse in a clinical setup will be teaching the client how to manage the unpleasant sensation of nausea and vomiting. The nurse would be identifying the aggravating and elevating factors for each and every patient, and they will be suggesting and educating the patient and the caregiver regarding the methods of prevention of nausea and vomiting individually. Nurse will be also educating the client and the patient and their caregiver related to the maintenance of the fluid level while they're having a persistent episodes of vomiting. Ventilation management or a well-ventilated and odor-free room or environment should be ensured by a nurse. Even the importance of it should be taught to the caregiver. Clear and calm, quiet environment often helps to improve the psychological stability of the client. So that has to be educated by a nurse to the caregiver. Sudden position change should be explained to avoid for the client to minimize the chances of the development of vomiting episodes. The client will be often taught regarding the usage of relaxation technique, even the diversional technique, to minimize the development of vomiting episodes. Next, we're going to see even the client here would be educated by a nurse regarding a proper rest and sleep, their activity, exercise, a proper dietary intake, fluid electrolyte level maintenance, even continuation of the medical therapy which has been prescribed. The nurse would be teaching the client and caregiver regarding the importance of the adherence to the prescribed medication and a proper follow-up. So I hope in this session you are completely understood the concept of the condition of vomiting. So we have seen here the definition of it, the probability-logical factor, the pathophysiological process, even the common clinical manifestations associated with this condition. Even we have learned here the basic medical and non-drug treatment therapies, as well as the nursing role and responsibility to manage the client with the condition of vomiting. So I hope you have enjoyed the session. Thank you so much for attending the session. We'll meet you guys in the next one.